We will be revising the previous year topics of AIMS today, and jitna bhi revise kar payenge, we'll try to revise it in one go. Okay, so let's just without wasting much time, let's just start with today's topic. So we are going to learn about the GI bleeds today. Okay, we are going to learn about the GI bleeds. Let's study about the GI bleeds. Okay, we are going to learn about the GI bleeds today. So to understand the GI bleeds, let's talk about the Dieulafoy's lesion first. What do you mean by Dieulafoy lesion? What is Dieulafoy lesion? What is Dieulafoy lesion? Can anyone tell me what is Dieulafoy lesion? So Dieulafoy lesions are basically stellate in appearance and they are dilated tortuous vessels. Okay, so these are basically dilated tortuous vessels. They can be seen in the stomach region, and in Dieulafoy lesions generally there is arterial bleed. Okay, there is arterial bleed, and we have the submucosal dilated arterial plexus. Okay, and Dieulafoy's lesions are common in males and commonly seen in first 6 centimeter of the duodenum. So this is the duodenum. In the first 6 centimeter of duodenum, you usually find the Dieulafoy's lesion. Okay, what is the treatment of choice for Dieulafoy's lesion? What is the treatment of choice for Dieulafoy's lesion? Answer it. Try to actively recall the treatment of choice. So the treatment of choice for Dieulafoy's lesion is actually your endoscopic clipping or endoscopic coagulation with argon plasma coagulation. Okay. Now, if you're not treating this condition, if you're not treating Dieulafoy's lesion, then submucosal arterial pulsations will erode the mucosa, and that will result in bleeding. That will result in active spurt of bleeding through these lesions. Okay. So this was about your Dieulafoy's lesion. The second type of lesion that you should know is about the gastric antral vascular ectasia. So in gastric antral vascular ectasia, what happens is there is dilation of capillaries at the region of pylorus. Okay, so there is dilation of capillaries at the region of pylorus, and usually gave is venous in nature. Okay, gave is venous in nature, and blood will be oozing out in this condition, not spurting out, but blood will be actually oozing out in this condition. Unlike the Dieulafoy lesion, where the blood is going to actively spurt out. Okay, and this Dieulafoy lesion, this of your Dieulafoy's lesion, there is spurting out of blood. Okay, and this gave usually involves the females more predominantly. So gave is more common in females, while Dieulafoy is more common in males. And there is dilatation of veins at the level of mucosa. So venous dilatation is there, but at the level of mucosa. And Dieulafoy lesion was occurring at the arterial level and at the submucosal level. Okay, so I hope this point is clear. So what is the treatment of choice? What is the treatment of choice for gave? What is the treatment of choice? Treatment of choice is argon plasma coagulation. ठीक है, gave के लिए the treatment of choice is argon plasma coagulation. Okay, photocoagulation. Next thing is we learn about the aortoenteric fistula. That is also a cause of GI bleed. So aortoenteric fistula, नाम से ही समझ में आ रहा होगा, aorta और तुम्हारे intestines के बीच में there is a fistula. So